Hello viewers, welcome to Beyond the Shift Talk Show. I am your host, Grace Wanjohi. This is a talk show created with people in helping professions in mind. It focuses on the field of medicine, the field of psychology, the field of social work, and pastoral field, and any other field that is classified under the helping professions. My focus is because in this helping profession, we deal with people by engaging with their emotions. There is emotional engagement. So we want to see what is required in the helping professions. Are we doing it right in these fields that I've mentioned? What can we improve on? And what are the benefits of doing the right thing? So today I want to discuss three concepts, and that is sympathy, empathy, and compassion. So what is sympathy? Sympathy is feeling sorry for someone who is in trouble or going through suffering, but this is from a distance. It is done from a distance. It is different from empathy, which we define as relating and resonating with the feelings of another person. So, what are the major differences between sympathy and empathy? As I have said, sympathy is someone who is feeling sorry for another person in problems or in suffering, but this feeling for is done from a distance. There is no emotional engagement. The person sympathizing feels relieved that they are not the one going through the problem, as opposed to empathy. In empathy, there is supposed to be emotional engagement. The empathizer feels or understands the feelings of the other person, engages in a connection that makes them be able to help. So in empathy, we say the empathizer recognizes the suffering of the patient or the client, relates to that suffering, and reacts to that suffering. So empathy is deeper than sympathy, and that is what is recommended for the helping professions. So the major differences include that sympathy is coming from the ego. The person sympathizing is feeling like this is what is happening to you, and I know what you should do about your situation. But I'm separate from your suffering. But in empathy, the feelings and the connection come from the heart. There's that willingness to connect and understand and allow this person to own the feelings. So in empathy, you allow the person, the client or the patient to own their feelings. If they say, I feel sad, I feel, understand, they feel that. Don't ask them, why do you feel like this? In psychology, we don't ask why. We say, we use words like what. What makes you feel like you are sad? So understand and relate to those feelings. Have you been sad before? How did it feel like? So that is what we are saying is relating. It's feeling with the person, not feeling for, like in sympathy. So that is one of the major differences, that sympathy comes from the ego while empathy comes from the heart. Another difference is that you allow the person to own their feelings. In sympathy, you are not giving that opportunity to this person to own their feelings. You are like advising this person what they should do about their situation. Another difference is that sympathy is only used during sad times or to someone with a problem. But empathy can be used at all times, even in positive situations. So how can we improve on empathy so that we make our therapeutic relationships better? We can do this by listening without judgment, listen without advising this person, listen with intention, listen with vulnerability. You have been there before. It can be you sitting on that side of the desk. So you listen with vulnerability, because this is what is going to allow you to feel with the person. But if listening from a distance, you are not able to really engage and understand what is happening to this person. So another way we can improve on empathy is by listening with understanding. This means don't listen to respond, listen to understand. Just surrender your feelings, surrender your judgment, so that you are able to understand your client. Just listen for the sake of listening. Most of the time in normal conversations, we listen to people to respond to them. So we are not even hearing them. So in an empathetic relationship, we listen to understand. So those are some of the ways that we can improve on empathy. What are the benefits of engaging in empathy? That is understanding and relating with the patient's emotions and walking in their shoes. The benefits are an improved therapeutic relationship, improved patient outcomes, improved patient satisfaction, better adherence to the management of care, whatever you decide on, whether it's a counseling session, whether it is in healthcare, whatever you decide on with the client or the patient, they are likely to adhere because, remember, they felt heard, they were not judged, they were listened to without being advised on what to do. You are allowing them to tell you what they would like. You are not the one saying everything. You have listened, you have understood, and now you're coming together to make a decision. So another benefit of empathetic relationships or engaging in empathy with their patient or client is decreased anxiety and distress. When a person feels heard, when a person feels understood, they are likely to reduce the anxiety. Remember, the people coming to us in the helping professions are coming with a lot of anxiety. Some are in physical pain and some are in psychological pain. So they are coming to us with a lot of anxiety and distress. What is going to happen to me? Will I get better? What can I do to make my situation better? So once you engage empathetically with your clients, they are likely to have decreased anxiety and distress. So the second concept that is encouraged in helping profession is compassion. By definition, compassion is a deep awareness of another person's suffering with an intention to alleviate that suffering. And compassion forms the fundamentals or the basics of helping professions. This person coming to you for help, they want you to understand their problem and then go a step further, you help. You just don't understand and leave them at that. They are looking for help. So compassion is a deep awareness of another person's suffering or need with an intention to alleviate that need. So it has been associated with positive clinical outcomes, and lack of compassion has been associated with negative outcomes or patient or client dissatisfaction. So how do people conceptualize compassion? The clients or the patients conceptualize compassion as helping, understanding, forming a relational connection, being gentle and caring, being warm, listening attentively, and being non-judgmental. In healthcare professions, it is also conceptualized as cultural sensitivity. When you are culturally sensitive to your client, maybe their mode of dressing. Some people in some cultures will have traditional marks on their faces, on their bodies. The way you ask questions concerning what you can see that looks different from what you know also is conceptualized as compassion, because you can choose to be not judgmental about those marks, about the mode of dressing, about the way they do things differently. So in a study done in healthcare profession, it showed that cultural sensitivity is also conceptualized as compassion. A very important concept in compassion is time. One of the things that was coming out in all those articles I read is that people do not want to be rushed as they give their story, as they give their problem, and they can tell when they are being rushed. Maybe the listener is constantly watching the time, looking upset, starts fidgeting, and this tells the patient or the client that you're in a hurry. So time was a big factor in all those scholarly articles. So listening without rushing someone, giving them enough time to express themselves, is conceptualized as compassion in the helping professions. How can we improve on compassion? One, it can be taught through role modeling. Number two, what was coming out from scholarly articles is that shared humanity can improve compassion. Let's say you have had a certain condition or you have been admitted to hospital because of a certain problem. Out of that experience with the patients and clients makes you a better person, makes you listen more, makes you engage more because you have been through that experience. Role modeling can be done to help people improve on compassion. So as I finish, the foundation of the helping professions is empathy and compassion. Empathy, you feel with the person, you understand and resonate. Compassion goes a step further and wants to alleviate that problem. So I urge you, people in the helping professions, to improve on empathy and compassion so that we can build better relationships with our patients or clients and thereby improving the outcomes of our engagements with our patients and with our clients, and that they can go home feeling satisfied with the services that they have received. So this being the premier show, I encourage you, if you're in the helping profession, to join this channel so that we can grow together. Like, share, comment, invite friends, invite colleagues, and also give feedback and create a place where we can learn from each other. No one has the monopoly of knowledge. There's a number on your screen, a WhatsApp number on your screen, where you can give your feedback, and there's also an email address. And until the next talk show, I've been your host, Grace Wanjohi. Bye-bye, and thank you.